So welcome to the Health for All Revolutionizing Healthcare session this morning. Whether it is the ancient medical treatise, Sushruta Samhita, or the colossal COVID vaccination drive, India's influence in the healthcare sector cannot be ignored. According to the Association of American Medical Professionals, Indian Americans mark 1% of America's population. However, they represent over 20% of the medical graduates that are in the country. So India's importance in the world of healthcare just cannot be ignored. Likewise, in 2020, EY released a report that suggested that Indian startups raised more than $500 million in that year alone. With their expertise, gosh, I'm not used to holding this, and I think I'm high maintenance. So India's expertise and India's knowledge and entrepreneurial spirit means that Indians are really leading the way in healthcare. In 2030, it is predicted that globally, that we are going to be short by 10 million healthcare workers. Now, India here has the youngest and most trusted workforce in the world. We're going to start with some opening remarks and also some introductions, and then I'll be happy to introduce myself as well. But I want to understand, we'll start from you, Dr. Jean. How do we share our medical expertise but not lose our capital labor in the country?
Awesome. So, Isha, do we do introductions and then
yes,
jump in?
And then just some opening remarks would be fantastic.
Just wanted to check. So, I'm Dr. Jean Shadatpuri. I'm a pediatrician by trade. I did my medical school here, very much in India, in Mahe Institute, and then went off to NYU to do my residency, and then jumped right into clinical practice. So I worked for Northwestern in Chicago, and then I went and worked in Stanford in California, because of course greener, brighter, sunnier pastures were in California, and then have been a California girl since then. After a while, I did my healthcare executive MBA in University of California, and then moved into administration. And here's where I think we're coming from a single entity, a single doctor, you kind of realize how to make a difference for bigger masses, and how healthcare alone isn't enough to get any change or any improvement anywhere. So was part of physician organizations, some health systems, hospital systems like Optum, Tenet, and then United Health. And most recently, I was the chief medical officer for the biggest payer in the US called Centene Corporation. And I think that's where the policy and the lawmaking came up to the forefront. So it's good to go through this journey, and after doing it all, you realize how you need to be your own boss and cut the red tape, and jumped into the startup world. And most recently, I'm in UAE now, handling family business. So I'm serving as the managing director for the Nikkei group of companies, and we're into electronics, trading, real estate, FMCG, IT, and some other businesses that we are foraying into. So jumping right into Isha's question, first of all, amazing panel this morning. I'm sure you guys had a lot of fun, and thank you, MR, for putting such a brilliant crowd and an audience and panelists together. So Isha, to your question, how do we prevent labor drain? I think we've been through this in the past few decades, brain drain, brain gain. We heard about it in the morning. But India has the masses, has the demographics and the diversity, and a huge widespread array of talented, gifted individuals, and a history and institutions that provide the wealth of knowledge that have been providing for many years, like IIT and AIMS and all amazing institutes. So I believe there doesn't have to be an exporting or importing of labor, but more transfer of knowledge through digital avenues, exchange of ideas through forums, probably make a consortia that is committees and representatives from all over the world that can actually share the findings and their learnings and then spread it to the rest of the. So I feel we need to build more of the bridges where we can transfer knowledge and technology and expertise and learnings rather than physically moving into different geographies.
Thank you.
Good afternoon. First of all, just wanting to introduce myself. My name is Sumit Agarwal, and I'm the Managing Director for Midmark India. Midmark is an American company which is producing hospital equipment. We have been in India for 75 years. We are India's largest when it comes to manufacturing hospital beds, stretchers, wheelchairs, and we have a wide distribution network across India. Prior to being in the hospital equipment space, I was actually in the hospital space itself. So I worked with Fortis Healthcare based out of India, but in Singapore where we were trying to establish base. So I worked in India and Singapore with Fortis Healthcare, and prior to that I was with the World Economic Forum, which was in New York, again in the healthcare arena, where my job was to build partnerships with Fortune 500 companies. And before that, I worked with Deloitte in US, where clients like Roche Diagnostics and Kaiser Permanente, some large other healthcare provider systems. So I've spent about 23 years in healthcare, and it's exciting to be here and share my perspective. I've had the opportunity to work across the globe and see healthcare from a very intimate standpoint. Thank you.
Thank you.
I'm Sunny Pokala. I'm a technology entrepreneur. I live between New York and India, so probably the best brand ambassador for Indiaspora. I run a technology company based in New York and the Bay Area with offices here in India. About 3 years back, I forayed into the healthcare space, wanting to build the first cognitive digital health platform, if I may, because I wear two hats. I'm on the delivery side as well. What I mean by that is that similar to what we have called 911 in America, we have a similar setup here in India called 112, which is called the National Emergency Response Services. So my organization that we created here in India is part of that, and we provide that to many states. We also run the country's women helpline, which is 181, which helps women in distress of all conditions, physical, mental, whatever it could be. And the National Emergency Response, the Senior Citizen Helpline, which is called as 14567. So being in the last mile of delivering care to people at large and a population that you can comprehend, we decided to help ourselves, because they say you can do good by doing good. So we wanted to build a technology platform that could move people from reacting to a healthcare incident to be more proactive and being in preventive care. By doing that, we reduce the need for people being rushed into critical care, thereby increasing the possibility or probability of providing better care to them in both home and hospital settings. The company that I created is called Secura Health, and I'm more than happy to share more information about that.
Did you have any opening remarks on the talent that we have in India, and how do we look after it? Because if we don't have the infrastructure and the opportunities locally, there's a lot of risk that we'll keep losing our precious young workforce.
Sure. So first of all, I want to say that the world has become very small. What we have ideated as a platform of using very, very deep AI methodologies and risk stratification, though the ideation has been done in Silicon Valley, most of the engineering has been done in India. So that shows the connect between how businesses coexist and work very closely with each other. Now, once the platform is built, now we are deploying that as corporate wellness programs or platforms into every corporate organization that's here. technology companies, manufacturing companies, thereby improving the performance and the productivity of the employees by providing them long-term care solutions. So healthcare, in a way, is coming back and becoming an important foundation for improving productivity and also job satisfaction. Happy employee is a better performing employee. So healthcare has now become an important component, and we are playing a very important role in that.
Thank you. So there was a reason that I started off as our first question around our most important asset, which is our people. And that's because this topic is very close to my heart. I was born in India, and my father decided to make a decision for us to move to Australia, Sydney. I remember being 7 years old, and up until the age of 7, I grew up in a big family house. I had my grandparents living in the same house, my uncle, my cousins, and it was absolutely magical. And then at the age of 7, I recall walking into school. Now, you've got to remember, my dad was so excited about having me and my sister starting school that at that stage we didn't have a uniform either. So we walked into the school playground with a typical Western outfit. But 30 years ago, even the Western outfits were very loud and eccentric. So I had all India written all over me, didn't know how to speak a word of English, and schooling started off tragic for me. So from day one, racism and bullying. And schooling was so difficult that by the time I was in year 11, I had crippling depression and I left school. That further tarnished the reputation in the family in a very small but thriving Indian community, or growing Indian community, in Sydney. So at the age of 24, after 4 years of depression, my father, who used to work for the government and had a lot of insights around the aging population, encouraged me to get a job in a nursing home. He pushed me into a nursing home, and I walked in with a resume and a pulse, and I got a job because I had a pulse. There was nothing on my resume. And that started my journey into the aged care and healthcare industry. I worked 6 months. It was my longest standing employment, but what I received from that time was a deep connection with people that are elderly, that were vulnerable, depressed, and lonely, which is effectively what happens to individuals that are left at that age in an aged care facility. But those were the 3 deepest emotions that I had felt up until that time in my life. So at the age of 24, I started a home care business, an aged care and disability business, and scaled that over the last 15 years. And we've been making huge impact in that area in Australia. Recently, because of all of the issues with COVID and mental health came back in my life, and not this time for me personally, but I saw this in my workplace with individuals really struggling with mental health and depression. We know this is a global issue now, and the maldistribution of clinicians and people, consumers that actually need help. I started a second business called Leora, which is an artificial intelligent mental health chatbot, and we'll go into that in a moment. Now, that sort of leads me to the whole thing around startup and healthcare innovation. Dr. Jean, maybe we'll go to you. What are your thoughts around startup, market adoption? What are the regulatory frameworks and challenges that you feel we are facing to get our product into market and then scaling across borders?
So startup is a different planet. I'm not sure how many of us can relate to here, but coming from a very high C-level to having multiple assistants and a plethora of manpower helping you, you go to a family office where it's pretty much family decisions, and then coming to a startup world where you're the one picking up the first call and saying, hey, I'm the assistant to Dr. Jean, hang on, let me transfer to her. It's a different world, and it's a very exciting world. One, the kind of passion, the kind of ownership which you would have even in your jobs, this is something that feels like your own baby, your own child. So to fuel that, you look for resources with a much more driven motivation than you would maybe if you were in a job or in any other line. In this case, when I started our mental health and behavioral health virtual platform, I knew the need, I knew there was a customer need, I knew the gaps in all the procedures and the policies. And I also knew why billions of dollars spent by the government, by the private businesses, does not achieve the actual outcome to the patient on the street or the person on the street. So to your question, I think startups need a very supportive ecosystem. It needs a lot of private-public partnerships. It needs laws and policies that encourage and incentivize the right behavior for not just the companies to come up with the perfect model or less than perfect model, but also to fuel them with the right resources so they reach up to the masses. On the adoption side, on the ground, the clients and the patients probably need to first be the most informed, educated person in this matter. So I believe empowering them to know about their condition, about their mental health, is probably the first and the most important step for a person to go towards seeking help. Or even 2 steps before, even to identify that they have a help that they need, they have a condition that they need help with. And that starts with self-awareness. That starts with signs and symptoms that we put out on our virtual platforms, how to identify. That puts out things like wearable data that can be easily communicated into our databases. And AI and machine learning can tell us the patterns and the identification of right up front when the process starts downhill. If Isha had access to, say, technology, or her parents had access to technology at the age 7, they would probably read about it, be more aware, and kind of figure out the pattern in their own families and seek help much earlier, maybe engage the people to help a child in the school environment. Bullying is not, it's not present, it's not past, it's been there for ages, right? So now that we are an aware society, and I think we're a much more accountable society to give back and to help others, technology is what enables us, and to get the word out is a lot of it to do with private and again, federal resources. So first, identify and get the awareness out that there is something called self-care and mental health and gut health, which is also very important to mental health. Second, give them resources to figure out how severe they are in the spectrum of this whole medical landscape. 2, to help them navigate. 3, to help them navigate through the maze of clinicians and hospitals and health systems and the billers and payment mechanisms and incentives, to take charge of their own health and to seek help and to make sure they monitor and work towards getting better and getting into being an economically productive citizen. And then 5, measure outcomes, and any model that does well to scale it up across borders, to scale up the learnings across borders, to share talented clinicians and clinical services across borders. And when I say across borders, I don't mean without any regulatory landscape. There has to be an international regulatory consortia that comes up with a standardized basic minimum security guidelines on data protection and HIPAA laws and things like that, and encrypted information flow so that the person is protected. You don't want this person to go through more trauma if the data is leaked. So I think it is possible. I think a lot of us have to just come together. Indiaspora being the bridge between US and India and a lot of other 24 more countries represented here, can actually do this in this forum. Once we have an offshoot or a focus to any issue, I think we can get that resolved.
Thank you. So do you believe that there's opportunities for us to harmonize, let's say, the regulatory environment? What is the FDA in the States, TGA in Australia, and the equivalent here in India?
So that's being formed in India currently. You know, there's a big push because in India, medical devices and pharmaceutical items would all come under the Cosmetics Act. So there was a Pharmaceutical and Cosmetics Act, and right now there's a discussion in Parliament about doing a separate, governing body which will look at medical equipment per se, because India realizes that, this doesn't fall in the ambit. It cannot be generalized, but there has to be mechanisms of regulating medical devices and pharmaceutical items in a very different way. So that is under formation. And the only thing which I echo what Dr. Jean said, the problem is regulation also becomes very preventing countries and individuals to start sharing information. And I think, there was just a recent report from G20 released in, I think, Ahmedabad or Gandhinagar, that only 5% of health data is being used globally. So if 5% of health data is being used, COVID is a testament of the fact that, we can all derive benefits if we were able to anonymize the information and standardize it. So as you rightly said, having a common minimum framework, which is there, and this collaboration of G20 is something where, things like this should be discussed and brought up. There is something called EHDS, European Health Data Space, where a lot of the European countries are sharing data in an anonymized way, and they're able to derive benefits out of it. So it is for the individual, first of all, to be made aware that, if you're willing to share your data and we are able to protect it by anonymizing it, that it can be rolled up at a community level, at a country level, at a continent level, and at a global level, which will only derive benefits and save 15% of the cost of a health system, right? So those things are something which I think we want. It's high time for change. And I think by just talking at G20 or doing, I think it's about action, because healthcare is really something which we all need to work on. The population is only increasing, going to be 8 billion or more. And there's just there's no other way to really survive with that many people on earth without being sustainable. And health is something which can sustain us for longer. So that's my take. But I think public-private partnerships with academia, research organizations have to come together. And if we can at least start it at a G20 level, I think that would be a good start.
Yeah, you make a really good point around cost savings as well. And often regulation is tied to even our payment models. It actually, spending 15 years in healthcare, one of the things that's always astounded me is that we're one of the only industries where we're not values-based outcome. We're still very much running on a transactional, volume-based care model where, yes, the compensation or the exchange very much relies on a practitioner's time, but Sunny, do you have any comments on how do we move towards more of that whole-of-person care and move into a values-based model of care?
That's a very good question. But before I touch on that, we all hear a lot about AI, right? I mean, everybody's talking about AI and healthcare. From a technology perspective, I mean, you all both touched it from a practitioner's perspective. From a technology perspective, what are we doing in AI from a 30,000 view? There are 3 areas where AI is being deployed, right? One is, how do you risk stratify? That means, how do you know ahead of time that a person is at risk? And that's where the entire AI innovation is happening at a very deep level. I'm talking about innovation, right? I'm not talking about ChatGPT and generative AI. These are all, you have 3 school kids getting together and writing a program to draw it, right? I'm talking about deployment of that. So in healthcare, from a technology perspective, AI first is on the risk stratification side. The next innovation that's happening in AI, in the technology side of using it in healthcare, is actually giving solid clinical decision support tools to the physician, right? How does someone in Nebraska use the same intellect that someone at Stanford is using to be able to decipher a disease? That's what the second phase of AI is. That's where the research is happening. And the third most important part is, how do you give a treatment recommendation based on multitude of data, including the new kind of data that's coming in, social determinants of health. How do you bring in genomics, genetics data, to be able to find personalized medicine, precision medicine for highly toxic diseases? For example, cancer. 1 out of 8 women in America have cancer. You go to a physician, there's one drug, one size fits all, right? Look at the toxicity level in that body where you're treating certain cells, but now you're treating the whole body, right? So that's the evolution that's happening in AI. These are the 3 areas. To touch on what you're saying about personalized recommendations and personalized services, this is where the new innovation of AI is happening, and that's what companies like us are focusing. And touching back on what Sumit said, we're working with IIT Chennai, we're working with large hospital chains where we are doing research on AI and then deploying it in the industry, which is on the provider side, taking that feedback, completing the cycle, and then try to deploy this platform or this algorithm at scale, which every provider can use in the future.
Sunny, just to add on that, how do we ensure that there's no biases and discrimination? Because effectively these AI models also rely on training data that is cleaned. And then we have, say, specifically in Australia, we have 30% of the population living in rural and regional areas. Again, marginalized communities have very different needs, personalized needs to, say, metro.
Sure. It's very interesting. My hometown is Chennai. I live in the city of Chennai, between New York and Chennai. The morbidity rate in Chennai is 75. Just 4 hours from there, driving distance, in Koli Hills, which is the tribal community, the morbidity is 50 years. 4 hours. So it's a very pertinent question that you're asking. But what the companies that are going deep in AI are doing is that they are democratizing the data that they are gathering to make their powerful engine. Because at the end, what are we trying to do? We are trying to use technology to democratize, one, the access of healthcare across the globe to every remote corner of the world. And the second most important thing, democratize the quality of healthcare that you're delivering. And the only way you can do that, garbage in is garbage out. Good data in is good implementation tools out. So companies like ours are working with people at the remotest corner, at the primary health center. That's why the story of AI. Now, different twist that Modi ji gave, America, India in healthcare, right? So algorithms in America. I'm not saying anything about Australia, so we can make Australia India as well. The point is, it's about innovation at the place where the innovation, the research is, at the MIT, at Stanford, at the institutions where the actual innovation is happening. And then use the India story, the playground, where you have access to data, right? People are willing to come in and work with us to be able to provide the data that is required across different diverse setups, right? Diverse democracies, right? Different regions, different social conditions. These SDOH data makes the combination of genetic data, social determinants of health, weather data, financial data, all this is pertinent about how your AI algorithms will start working in the future. And that's what the innovation is happening in.
Yeah. Whilst we're on the point of data, it brings up a very important point around privacy. It's the number one consumer concern. So you mentioned this earlier as well, Sumit, when we were talking about cross-border collaboration. How do you think India and other nations can work together to establish frameworks that are secure and allow for ethical sharing of data?
So we don't need to reinvent anything because, you know, there is, as Dr. Jean also talked about, HIPAA, right? For example, there's already a framework in the United States which works out well. There is PDP, which is Personal Data Protection Act, which is out of Singapore. There is, EHDS, which I said in Europe. So there's a lot of work has been done towards it. So we really don't have to reinvent the wheel, but we need to implement certain things which are already there and set it as a gold standard. For example, if it was G20, these nations agree. And we are sharing data in so many, when we are when there's trade, I think customs is, you board a flight, before you land, you're sharing data of the passenger with the country where they're going to be landing. So there are mechanisms which are there, but unfortunately, healthcare is too protectionist, right? And it starts with the individual. And I think till the individual and the healthcare providers realize that it's only for the greater good, it will continue to be the same. Now, there are other mechanisms like Health Level 7, HL7 is the communication mechanism. SNOMED is there. We have ICD-10. These are all available, right? These are, just for the audience, it's a nomenclature which is common to healthcare, right, globally, and many countries have implemented it. So can we not use those and anonymize data and further roll it up so you can know what interventions are required at an individual level, community level, at a state level, at a country level? I think you can know if a pandemic or is going to be coming with just monitoring constantly this data. And there's a very good example of Kaiser Permanente, right, where I had an opportunity to work or consult when I was with Deloitte. Is there a community-based healthcare organization where they look at population health? So they have 10 million members across, I think, 9 states at that time. And they had about 60 hospitals. So 60 hospitals and maybe 100 clinics serving 10 million people. And they had their own insurance. But their best part was they were monitoring data on a continual basis. And they drove interventions beforehand. So if you are smoking, they would say, okay, let me call you in for a smoking cessation plan. Should I, if you're planning, if they see certain parameters that you're getting diabetic, let me get you in. So I think that's the kind of collaboration that is required, and it already exists. I think we just have to sit on the table and agree and share data. That's what I think.
Mm-hmm. And I think as we're talking about data, this is going to move us into an era of preventative healthcare. We're going to move away from that reactive sort of, now we're in critical care of need and now let's respond to this. We're going to move into prevention. Prevention is going to require either us as providers supplying tools for individuals to self-monitor and to some degree self-diagnose, but it's going to require digital literacy. And again, those marginalized rural and regional communities. So, Dr. Jean, what's your thinking around how do we ensure that we're not compromising the communities that are marginalized? We ensure that they have either, one, the tools to be able to monitor, and also then the digital literacy so that we take them on the journey of progress.
I'm going to weave in the answer to your question, taking Sunny and Sumit's good points. One, we are 8 billion population. So both of these panelists said something about SDOH and financial data and all that. So I want the audience here, because you guys are the ones who are going to advocate this outside. Mental health, a physical health of an individual is a collective of the environment and the milieu that you're in, right? So this would depend on the family conditions, on the environment conditions, on the financial environment that you're in, on the work stress, on your, even if it takes you 3 hours to get to work, is some kind of stress that's adding onto your back or on your mind. We would have to look at healthcare as a consequence of what's going around in the milieu. Right now, how do we bring that together? We have Google, we have our phones, we have a lot of places where we collect a lot of data about ourselves. India, there's a scheme in India called Ayushman Bharat that they spoke about. It covers 500 million lives, right? I mean, our entire population of US is 338,000 million. What I'm saying is touching 500 million lives in India on a government-backed scheme is a challenge by itself. What has been growing here more than actual literacy is digital literacy. We have more than half of India's population now that has an unprecedented surge of internet connectivity. And I'm not just saying internet connectivity, but more of high-speed broadband, sustainable internet activity on their phones. Now, once they're doing their financial transactions on the phones at a kirana level, at a very low income level, now they're digitally literate, which means now we can use that platform to address the most challenging healthcare issues through the platforms that they are familiar with, and they know how to communicate with. The key to this would be localization and regionalization of content in a way that it's not only language friendly, but it's also culturally sensitive. And the way they would go about seeking help may not be a doctor, it may be a community health worker or a social worker in the case of the US, where they're more familiar with their conditions, which means if you give them medicines for worth $1,000 and they don't have money to pay for electricity at home, it's not going to happen. So this needs to be more of a social movement rather than just a healthcare or a practitioner movement. So to that extent, we would need transparency and trust and information flow of all these factors that come around to create that milieu for the person that now has the person aware and aware of their condition, and now they want to seek help for any of the services. Ayushman Bharat is amazing. E-Sanjeevani is another scheme that is telemedicine for all, free for all, and giving them access to specialty care, tele-ICU. So now we have small hospitals in smaller tier 2, tier 3 towns, which are now getting the help from ICUs from bigger tertiary hospitals through remote specialist help. Or we have primary care centers, like you said, that are empowered now with technology and an iPad, where all the people come in and get access to clinical decision support making tools, treatments, recommendations, subsidized medication, and then the social help that they need. So I think it's a transformation. I think it's an advancement of the entire demographic and population of India. And if you make an impact in 1.2 billion people in India, you'd make an impact on the planet. So that's the hope.
Thank you. Thank you for that. Did you want to expand on any of those points?
I think Dr. Jean covered most of the point. Just one thing that I want to add is that technology that's being developed in India and being deployed at the rural levels is very innovative and far superior than most of the technologies that exist outside of the world, right? Case in point, are you guys aware in Shillong, vaccine for a snake bite is delivered by drones into the villages, right? It used to take 6 hours for an ambulance to react to an incident like that. Now it's delivered by drones, number one. Number two, the points that she touched on, Ayushman Bharat and all these programs for the government are very, very effective. They are really reaching the masses, right? And the problem is being solved multifold. One, most important, drinking water. Are you providing clean drinking water? That's the food, clothing, and shelter is the house in which your health is going to be built, right? So from a grassroots level, it's being solved. Then comes the innovation. And that's where the Indiaspora story of carrying the innovation from the universities and the research facilities in the rest of the world into India. So when India gets the new platforms and the technology that's being delivered, it's 5G, right? We still are at 3G in New York, right? So that's the point. When we are deploying real-world technology and real-world inferences from the research, they are getting the best. And it's only going to improve from here. Now, the only worry that I have, right? We are increasing the longevity of our senior citizens, right? When that happens, you have a healthy mind but a weak body. That means your biggest challenge in the future is going to be mental health, right? Your body is going to live longer, medicine is going to solve your problem, organ transplant is going to keep you going. Till when? How? How are you going to address insurance for people over 80? So there is a new problem that you're creating, but that's a good problem to have. And someone needs to work in that space. And a lot of people are.
Yeah, feel free to comment.
Yeah, just I think, no, the intent of Ayushman Bharat and many of these schemes is fantastic. But I have to say that I don't know about the sustainability. Because outcomes from that, I think there's a lot of fraud in it. Reimbursements are so poor that the private sector doesn't want to participate in Ayushman Bharat. So it's there. Yeah, the numbers look very rosy. But I'm again propagating that, you know, if we want to do, we should look at universal health coverage, and it shouldn't be like a Robin Hood approach of the rich paying for the poor in India, and that's never going to be sustainable. And these schemes are populist schemes, which are there, and I'm hoping that, you know, that's the direction we move in the next 4 to 5 years. But at this point, I think Ayushman Bharat and many others are still in their infancy stages. The way the outcomes are coming out are not that great, but the intent is right. So hopefully we see much more momentum around it, and technology will play a big role. I support that. Yeah.
So on a more positive note, I think on a more optimistic note, 500,000 lives reached, right? 150 million visits happened, and 697 fake claims were made by hospitals that were billing for dialysis and organ transplants that didn't have any facility like that. But for a country like India, something like this, to just even get it launched and started and get the funding away from all the other industries, because you have urban development, you have transport, you have Ministry of Family Welfare, you have all these different ministries, all these different states. I mean, think about this, 1.2 billion, right? We are talking about US and all these initiatives and all this funding going into it. If you make a difference or in even a slice of this population, now median age for India is 29. So here is where that whole digital prowess and adaptability and tech savvy people are going to drive all these things. There are influencers that are out there, right, that are on social media that are going to influence the rest of them. And then these youngsters hopefully are going to be the driving change for the elderly at home and are going to be taking care of the elderly at home. In India, the culture still is alive and kicking where they do take care of their elderly, right? So hopefully they're the ones who are going to be partly helping and empowering the elderly to get care. I think schemes like this, technology like this, needs to go in every remote part of this country. Like Sunny said, some of the technology that has come in the fintech world is even more advanced than we have seen anything in Europe or in US. So I'm very optimistic. I think the political stability and the cohesion is important for this country more than any other time now, because now is when the progress is happening and technology and digital innovation is happening and artificial intelligence is being put to good use. But you're always going to get the bad water, and you just have to figure a way out to deal with that as well.
Thank you. Thank you for that, Dr. Jean. Now, before we hand it over to the audience and I'll allow you to engage, I just had one final question, because I'm also looking at this from a consumer lens. We are moving into this era. There's definitely going to be a lot of use of data. We need to be mindful that this data is not used or misused, right, for decision making. So there is this perspective that the general consumer holds, is that we will move into a surveillance state. And there's fear of inputting that amount of data into technology. Would anyone like to share any views or any reassurance on this?
Big Sam is watching, is that what you're saying? So one thing I touched upon briefly earlier was empowering the consumer, right? So if they are empowered and they're smart about their conditions and they're educated and they know how to identify not only themselves but also the classroom they're in, or the union they're in, or at the work environment, or in their own family, or for their own kids, most of the awareness comes from there. So I am based out of UAE now. One single woman would be taking care of multiple children, husband, in-laws, parents, right? So this woman is deciding all the grocery that comes into the fridge, all what the kids take for lunch, all what the servants cook in the house, and then in-laws and elderly, and they're managing their diabetes, and they're managing their asthma and their medication. Now, this one woman could do a lot with technology and integration of systems and informed decision making and access to healthcare, not by physically driving into a clinic, but on their virtual phones and smartphones. Now, if I make this woman educated and informed and smart about things, she would now determine what the whole household is doing, correct? And she's just a housewife. So a lot of these impactful things that we don't think of are going to be a big thing, even for places like India, and that's where I think the progress is.
Thank you.
So security, and yeah, if you're being watched, for example, AIMS had a data breach not too long ago, and that was something not done completely. I think, so another thing, we manufacture a bed, right, which has the capability that the patient lies on it, and we are able to get some vital information of the patient, right? Heart rate, blood pressure, non-contact, right? And I've been taking that solution across the world. I went to Oman, I went to Kenya, I went to UAE and many other countries, and said, would you take this, because it has the diagnostic capability in it, right? And it takes a few seconds and it starts throwing data. The restriction around it is you have to keep the server in my country, because I won't allow you to have the data of the patient sitting anywhere else. I agree and disagree. I mean, yeah, there is some way of saying, let's keep it, but would you rather not have it more secure if Amazon or Azure or whoever says that, I can secure this for you, I can do it, whether it resides in any other country? I think that's where we need to see change. I think there's some archaic thinking around, oh, it should be in my country or whatever, but it will protect it. Yeah, it's my citizens' data, but should we not think from a technology standpoint that, wherever it's done best, we leverage that and do it? So yeah, whether the government is watching, it depends on country to country. But I think from a security standpoint, we should leverage the best and make sure that those servers don't have to reside in the same country. I think it's a very limiting thought process right there.
Thank you. That's a really good point. I know that some of the audience members have a few questions. Do we have any roaming mics? Thank you. We might just
Hello. Pranima Voria from United States, Denver, Colorado. Very much interested in what you said. I'm grateful to Mr. Agarwal. You were very candid in saying that private sector doesn't want to participate. And I enjoyed your comments as well and yours. But my question to people here in the audience, as well as you, whoever wants to address that, what is being done regarding the medicines, the prescription medicines or generic, what have you? I want to bring that up because we have a big lobby in the United States. And I'll tell you, I'm diabetic, I have heart issues and blood pressure. I take all my medicines from here for $1,000 for the entire year. The same medicines I was told by my insurance company there, that even though they may be generic, but they are costing me $5,000 for 30 days supply. So they are bringing it from India and selling it for so much. And that's why the trips are free for me, because I save so much on medicines. We need to come up with a good solution on this, because obviously India is manufacturing at a fraction of the cost. We have made a global name for ourselves. What about the lobby in the United States? How do we enable our pharmaceutical companies so that they are making that kind of money? And what can India do to address that issue? Thank you.
So it's a deeper and more complicated answer, but I'll try to summarize for a consumer, which is so important for you, because for you it's personal, correct? There are a lot of these factors, and plays that come into the picture. One is a lot of pharma companies inherently do a lot of research and development for years and years. So if you see any drug coming to market, you have multiple phases, multiple clinical trials that they have to spend on. Now, if you are running 10-year trials in a country like US, it's going to cost you a lot. When they do reach that breakthrough of getting FDA approval, now they want to reap profits because they're a public listed company like Pfizer. I mean, wouldn't name any, but now they need to reap profits in say the next 3 years or 5 years. So now the pricing at an entry level in the market of a drug that has a patent and is not replicated anywhere, those are their 3 or 5 golden years to make profits before another person comes with a duplicate. But all things all, I think it should be affordable for all. When we were in COVID, and I was on the COVID task force team in the US, we had no drugs, we had no vaccines. So imagine their muscle to arm twist us into charging whatever they needed. And it was not until the federal government intervened that we could make it affordable and accessible to all. So it has to be that public-private partnership, collaboration for the greater good. Right now, I'm not saying the pharma companies should lose money, but I think we're going to see many years till they do that, right? So a lot of this can be plowed back into the communities, even if they're making profits, if they choose to give subsidies to people who can't afford it, or subsidies to other countries and scale up their manufacturing to give it to other third world countries, even that would help. I think India is in a great position. It has a lot of good manufacturing bases to take a lot of advantage to get the medicines out globally.
All right.
So just quickly, I think there's only one word: greed. And I think that is there. If you look at US, I'm a US citizen. First of all, I want to say that $4 trillion is the spend on healthcare every year, out of a 10 trillion which is spent globally, right? India spends about $250 billion, right? So we are very tiny in that. So what is that 4 trillion for a 330 million population? It's because everyone wants to make money. So it's without 10 to 15% markup, no one will do business in the US. In India, we do at a 1%, 2% margin. So I think it's just pure greed, because India has the solution, and we need to convince governments to say that there has to be a limitation on those profits, and that's something which is completely missing. So, but in Africa, India supplies, and there's very little margin on which they operate. But it's a mindset issue which has to be changed. That's what I'm saying. It's greed. It's pure greed.
Thank you. Would you like to go ahead, sir?
Hi, Isha. Thank you very much for this wonderful panel. All of you have been talking at a very high level of healthcare. And I'm going to come to the level that you work in, Isha, on running institutions which look after people, and something that we experienced at COVID, where the care workers were actually not really valued. So given that India, we have a shortage of, if you look at the beds per population or all of that, we aren't even on the charts. So let's not go there. But what I want to actually talk about is how can we train people better to be better healthcare professionals? And can that market, can that workforce that we have here, and people need lots of jobs here, also be taken to the developed countries like Australia, where there is a shortage of people in, in the aged care, home care, all of that stuff? Because what we've got to realize is that here we do look after people at home, but we don't have an option actually. Even if you're pretty well off, there are very few places that you can actually take people to and get good care, and feel safe that, the guy's not going to disappear in the night and your dad gets up to go to the loo and falls down and breaks his hip, and that's the end of him. So, it's a training and keeping up with that training. And of course there's a big technology angle in this as well. You can train in different languages. You can train in different ways. What are your thoughts on that, and what is the potential for that? Market?
Thank you. I'm actually happy to take this one because our business in Australia was just named one of the top 10 most inspiring workplaces in Australasia, and we've been 4 years best place to work in Australia and New Zealand. Your question is very valid because we could have all of the technology, we could have all the systems and processes in the world. Healthcare still relies on one fundamental truth, and that's trust. And so just from personal experience and scaling my own business, it fundamentally comes down to psychological safety in the employer and employee relationship, which I think is still very much lacking in organizations. I think that it goes to the fundamental relationship and first and foremost, the trust that's formed between how you look after your people. If you look after your people, they will look after your clients. From a training and education perspective, absolutely tapping in and having those relationships and collaborations with the best of universities is crucial. And then obviously using digital tools to be able to now scale training and education because it's not reliant on that one sort of facilitation of an exchange of information.
Yeah, but just making the point, even if you get the best of care, okay, it's the recovery after the care that's very important. When you're in the hospital or you're at home or whatever, and you need that help. So how are we training people to do this? How do we train them, that how do you be hygienic so you don't get an infection? All of this sort of stuff, I think this is, it's all very well to go for the really big stuff, but we aren't even in the bit which is really needed.
Did you want to expand?
So I think to your point, you mean not just the individual who needs care, but maybe also the caregivers around them. So a lot of the care is moving into people's homes now. And that's how it's going to be scalable. And like I keep saying, if you make the caregiver and the individual smart about how to handle themselves, you've jumped right into the preventative space, right? And now they're not ending up in the emergency rooms, they're not ending up in the nursing homes. A recovery for a fall, by the way, is 3 months for 80 and up or 75 and up individuals, and the financial losses even more, apart from the financial burden that the caregiver or the person bears for that care. So it's extremely important that fall risk precautions and things like that are followed to the T. And for that, it's more always around the caregivers.
Madam, please, we all know that. What we're saying is we don't have the people to do that, right?
No.
So how do you train them to get to that point? Because God forbid something happens to one of your family members, you can't work. What are you going to do? You're sitting home looking after that person. So we actually have to think, how do we train people better, and how can we as Diaspora help to get some of the people in India that need jobs to be trained in the right, the skill level, so they can also get jobs. We don't have to export all our software engineers. We can also take some people who are not that.
Actually, I think we shouldn't be even thinking about exporting because we have 200,000 doctors, which we are short of, 400,000 nurses, and about 800,000 GDAs are required in India as of today. But there are certain initiatives that are being taken by state governments like Uttar Pradesh and others, where they have asked the private sector to come and do train for GDAs. So, at home care, you don't require a nurse, you don't require a doctor. You can have a general duty assistant who can do the basics of medical care and administer injection, take care of any emergency situation. So there are certain states which are doing that. The only way, sir, I feel we can do it is that they're all lacking funding. And that's what is so their intent is right. The private sector is also stepping in some ways where, certain hospitals are trying to do the training in conjunction with the government and the schemes, but we require more funding. India still spends 1.3% of GDP in healthcare, right? The government spending is 1.3, 3% comes from the private sector. So I think if the Indian diaspora can do anything, is to fund the education part of things a little bit in that way. but intent is there.
Thank you for that. And outside of funding, of course, the partnership. So I think just this platform in itself, and there's, I shared my example, but there's plenty of collaborations and partnerships here and organizations that may not have that same experience of challenges. So we're very close to time.
Yeah, I'm just giving a plug-in. I'm Mahesh Pakala. I'm from the Bay Area. And I like what Sumit said. I'm an ex-Amazonian. I've been there at Amazon for the last 10 years, built the biggest pharma companies, the back end. Like you said, the infrastructure is the key for building out. That's where you build the trust. If this data is not secure, there's no trust. So I'm providing services for that. That's my plug-in. My company's name is Amazon X Services. We are all ex-Amazonians who provide services to all the data and the healthcare providers. Okay? Thank you.
Okay, thank you for that. I'd like to extend a special thanks to all of our panel members here and their thoughtful contributions in today's conversation. We know for a fact that with all of the digital technologies that are coming through, we are going to live longer. But I think I have one last question, which no one needs to answer now, just something for us to reflect on, is that we will live longer, but will we live happier? Are we going to have more peace of mind? Because even with our current state of privileges, the amount of wealth and abundance that is around us and the level of conveniences that we have, we are the most disease-ridden, overweight, heavily medicated, and depressed population group that has ever walked on Earth. And I say this with a really strong message around the next 10 years, our life is going to get further complex. We're going to be living with AI robotics, machines, and machine tools that are going to be far more intelligent than the average human being. So for the first time in history, even our intelligence is going to be diluted. And I think our reliance is going to be on our ability as humanity to actually rise our state of consciousness and compassion. With that, I cannot end a healthcare panel session, without actually emphasizing that we meet here today on the land of incredible India, where we have the Eastern philosophy, which is the foundation of all preventative health. Yoga, Ayurveda, meditation. So the world doesn't just rely on us for innovation and emerging technology. It actually looks to us for our Eastern wisdom and Eastern philosophy. And I encourage us, as I end this session today, to really forward our very inherent wisdom that lies within us as we continue to build these technologies. And thank you again for your engagement. Thank you again to the panel members.
Thank you.